Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. This week, you guys, I have been having a lot of nightmares. Now, that's not really abnormal for me, per se. I frequently have nightmares, and that's just how it is. They generally have the same themes of, general death and destruction and terror in general, but that is usually, I think, just coming from having a lot of anxiety about changes in life and stuff like that. So my friends say that those are classic anxiety dreams. However, I have them at such a great frequency that I'm considering discussing it with my doctor. So if you are in a similar boat and frequently have nightmares, I want to talk a little bit about nightmares, night terrors, and perhaps even sleepwalking today. So what is a nightmare? It's just a really disturbing dream. And we often think of nightmares as being something that children tend to have. But that is not necessarily true. So it is true that nightmares are more common amongst children, but about 50% of adults have a nightmare on occasion. They say that between 2 and 8% of the adult population has nightmares. So are your nightmares causing you significant distress? Are they interrupting your sleep on a steady basis? That 2 to 8% is people who are plagued by nightmares. So folks like me who have them nearly every night and they mess with your sleep cycle a little bit. It's important to try to figure out what is causing your nightmares, particularly if you are an adult and you're having recurring ones. That's the only way we can really try to reduce the amount and frequency of nightmares that we're having. So in addition to just being a disturbing dream, nightmares tend to also be very realistic or vivid. You may be more likely to remember a lot of the elements of the dreams, and they can even rattle you awake from a very deep sleep. Nightmares tend to happen most often during rapid eye movement sleep, and that's when dreaming in general tends to take place. Now, your REM sleep becomes longer as the night progresses, so you might find that you have nightmares in the early morning hours more often. So the further you are into your sleep cycle, the more likely that you may be experiencing nightmares because you're having more REM sleep at that point. The types of nightmares that you have or the topics in them just really vary from person to person. Some folks have a lot of nightmares about falling from a great height. I've had that one over the years, but mostly when I was a teenager. And, a lot of folks also have nightmares about not being able to, escape danger quickly enough, not being able to throw a punch hard enough, or not being able to run fast enough. And if you have experienced a traumatic event, like an accident or some sort of personal attack, then you might be having recurrent nightmares about that experience. A few years back, I went down a series of small waterfalls with some friends, and it catapulted me out of the tubes. And when it did that, I almost died. I did not surface until after the third waterfall and got battered around on the rocks and everything, and it was pretty terrifying in the moment. But I was like, oh, okay, I'm fine. Everything will be all right. But I had nightmares every night for months afterwards. I don't know if that was just bringing something else to light at that moment, but it did seem to trigger some sort of anxiety at the time. Now, I didn't have health insurance at that point. I was in grad school at the time, and I was not able to go and speak to anybody about that, or even go to a regular doctor and be like, hey, I'm having all these nightmares. Indeed, at the time, I did not even realize that having these chronic nightmares could be medically treated. That never occurred to me until one of my friends showed me her medication that she is on for chronic nightmares. That blew my mind a little bit. I could understand maybe going and having therapy for it, but it just did not occur to me that you could chemically treat your brain and your body for having nightmares. So if you are like me and you had no idea that that was a possibility, stay tuned. We're going to keep talking about that and get around to how to perhaps treat these nightmares. Now, your nightmare could be anything, really. What scares one person may not be the same that scares somebody else. And there's a big difference between just disturbing dreams and nightmares. So if you're waking up like in a sweat, or you are really freaked out by it, or you're angry or sad or just overly emotional when you wake up, that's going to be a nightmare. If you just have a really disturbing dream, like that one where all your teeth fall out, lots of folks have that one, that's just a disturbing dream, generally, unless there is something particularly horrific or emotionally upsetting about that specifically for you. One person's disturbing dream may be someone else's nightmare. Now, there are nightmares and night terrors, and we'll get a little bit more into night terrors later on, but both of those cause people to wake up feeling very fearful or anxious and upset. And night terrors tend to happen in the first few hours after you fall asleep, and they're more of feelings and not dreams. So a lot of folks don't remember why they're terrified when they wake up. They just wake up suddenly very frightened. Whereas the nightmares, you tend to actually remember those because they're dreams, not just experiences of being scared while you're asleep. So what causes these nightmares in adults? A lot of times they're spontaneous, but they can be caused by a lot of underlying factors and disorders. So you may have nightmares after you've had a snack late at night, because that can increase your metabolism and tell your brain to wake up and be more active, but you're falling asleep. So your brain is kind of doing that by creating these nightmare scenarios. So maybe back off the late night foods. There's a little bit of truth to folks saying that, you must have eaten something weird before bed. There are several medications that have also contributed to nightmare frequency, especially like SSRIs, any drugs that are acting on the chemicals in your brain, like antidepressants or several different types of narcotics. So legal drugs and illegal drugs are often nightmare related. Now, non-psychological medications like blood pressure medication can weirdly also cause adult nightmares. So you might not normally think of these things as being likely to cause nightmares. You're like, oh yeah, that can affect my blood pressure and my mood and stuff like that. But it can also really affect your mind. So if you are going through a type of withdrawal like alcohol, tranquilizers, antidepressants, that can trigger nightmares. So if you've recently started a step-down program for your medications, or if you are quitting some type of substance, then you may see a difference in the frequency of your nightmares. Go ahead and talk to your doctor about that. They may be able to prescribe something for you or make some suggestions to help you out. If you have sleep deprivation, like me, so I struggle with insomnia a little bit, both falling asleep and staying asleep, and then I tend to oversleep once I do finally get to sleep that last time. So I'm tired all the time, you guys, and that sleep deprivation can really also contribute to having nightmares. and that makes you lose additional sleep. So it's a nasty little positive feedback cycle where these nightmares are kind of waking you up, and then you're tired throughout the day, and so you don't tend to get a lot of rest. Now, they have not entirely confirmed whether that positive feedback loop can lead to nightmare disorder, but sleep researchers are looking into that now. Now, there may be any number of different triggers that can cause nightmares for adults that are psychologically related. PTSD is going to make you experience chronic recurrent nightmares. So if you have a lot of the same nightmares repeatedly, even if you think it's not about that particular event, our minds have a way of manifesting things quite strangely as we attempt to work through things that are bothering us. Our minds are trying to process what is going on in a way that can help us work through it, but it's abstract at that point. It might not entirely make sense, but if you're having the same dreams, the same nightmares rather, repeatedly, and you are having nightmares frequently, that may be associated with PTSD, and you should speak with your doctor. Anxiety and depression in general can also cause nightmares in adults, just like the medications that are used sometimes to treat them. So it's a mixed bag here. You cannot treat it and have nightmares. You can also treat it and have nightmares. So it's important to work with your doctor to find an approach that works best for you. You can also get them from certain types of sleep disorders. So if you have restless leg syndrome or sleep apnea, the folks that have the Darth Vader CPAP style mask, then that can also lead to nightmares. If you can't figure out exactly why you're having these nightmares and your doctors cannot figure it out, you may have a very specific sleep disorder that is about having chronic nightmares. Like the nightmares in and of themselves being chronic may be a sleep disorder. So if you have nightmare disorder, you may be more likely to have another condition that's associated with it. But you also may have relatives who have nightmare disorder, and that can make you more likely to have the condition. So they do think that there may be a genetic link of some sort for that. All right, we're going to go on a quick break, and when we come back, we're going to talk about how these nightmares can negatively impact your health. Stay tuned. Watching your business idea come to life is one of the greatest payoffs for any entrepreneur. And nothing really says that you're up and running and ready to take on the market like having a personalized logo, website, or business card. Design Crowd can really help get you to that place. Design Crowd is a website that helps entrepreneurs, startups, and small businesses, everyone from dentists and accountants to personal trainers and even Harvard Business School, outsource or crowdsource their custom logos, business card, and web design from over 750,000 designers across the globe. All you have to do is go to designcrowd.com and post a brief describing the design that you need. Design Crowd will invite all 750,000 of their designers to submit a proposal for you, and within hours, you'll receive your first design. A typical brief will receive between 60 to over 100 different designs over the course of 2 to 7 days from these designers around the world. Then you just pick the design you like the best and approve payment to that designer. Design Crowd takes a lot of the guesswork out of freelancing and having to pay for something up front when you're not sure you're even going to like it. With Design Crowd, you have a low financial risk and a great creative reward. Right now, for a special $150 VIP offer for our listeners, you can go to designcrowd.com/health and wellness to learn more and save up to $150 when you start any project. That's designcrowd.com/health and wellness. DESIGNCROWD.com/health and wellness with no spaces, or simply enter the discount code health and wellness when posting a project on Design Crowd.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back. Before the break, we were discussing nightmares. So now I want to delve a little bit into what are the health effects of nightmares. Well, they are initially just bad dreams, and they can make you really bummed out when you wake up. But a lot of people who have nightmares are already anxious or depressed. And if that is you, then you may be even more likely to be distressed about the nightmares and have more psychological effects related to it. Now, it's not entirely understood how these are associated together, but nightmares have been associated with suicide in some studies. Now, they may have a significant impact on your quality of life, but if you're starting to experience them regularly or they're starting to make you consider suicidal ideation, then you should really reach out to a medical professional, whether that is your general practitioner or seeking out a counselor. If you have sleep deprivation, that can be caused by nightmares, and you can also have a host of other medical conditions, including heart disease, depression, obesity, or diabetes along with that. If you have nightmares as an adult, then they may be a symptom of untreated sleep apnea. So ask your partner if you are sharing a room with a partner or a roommate at a certain point. If you are perhaps struggling with your sleeping, if you are a crazy loud snorer, then you need to maybe go talk to your doctor or sleep specialist about seeing if you have sleep apnea. Also, if you have PTSD or other underlying disorders, those can have a significant negative effect on your physical and mental health through those associations with those nightmares. So it may not just be the PTSD or the apnea in general that's causing the problem. It can be both. We often think of, the types of disorders that are more readily recognized as being a bigger deal. But even something like nightmares that we tend to brush aside, even if they do bother us significantly, it's really important to keep in mind that those can be disorders in and of themselves, and they can also negatively impact your life. Now, there are steps that you and your doctor can work on together to reduce the frequency of your nightmares and the negative effect that they're having on your life. If they're the result of a type of medication that you're on, then you may be able to change your dosage or prescription to get rid of the nightmares. It's important for you to kind of keep a log of when you started having these nightmares. You don't necessarily have to write down what the nightmares are all about and everything unless otherwise directed by your doctor, but just keeping, a little section of your bullet journal available for that, or marking it on your calendar. Doctors like for uterus havers to keep track of our menstrual cycles, and one of the ways that I have done that in the past is just by putting a little red dot on my calendar. And I know that that specific red marker is meant to denote that I had my cycle that week. You can similarly do something with nightmares. You can put a little X on it in a certain color or certain location, or an N for nightmare, whatever helps you to denote that and keep track of it for yourself. That way you can see the frequency, if nothing else. If you're having multiple nightmares per night, you may also want to track that as well, in addition to your nightmare picking back up when you fall back to sleep. That one happens to me quite a bit, and they're only supposed to really be occurring, or most frequently occurring at least, during your REM cycles, so once you are good and asleep. That means that it's super weird for me to be having those, picking those right back up as I go back to sleep, because I can remember waking up at that point. So I came to full wakefulness and then go back into having nightmares. So keep track of that as well. At the bare minimum, it's good to keep track of the amount and the dates and trying to figure out when they started so that your doctor can go, okay, so you say that these started back in December of last year. That's when we started you on this particular medication for whatever you're having trouble with at the time, and those have been known to result in nightmares. Let's change your dosage or try a different medication that's less associated with nightmares and see if that helps. And that way, you're not having to add more chemicals on top of it if that's not what you're wanting, and you can just dial back medications or swap them out. Sometimes that works. For a while, when I was also having nightmares, I was having a type of paralysis in my arms. So it was like ulnar paresthesia. So I would go to sleep, and when I would wake up, my arms would be numb. Now, there were a couple different reasons for that, and it still happens a little bit here and there because the ulnar nerve is being compressed and it is causing my arms to be a little bit tingly and go to sleep. But for a while it was happening every night, and I was also just not able to move my arms immediately upon waking. And that was not sleep paralysis. It was due to a sleep medication that I was on. So the sleep medication helped me get to sleep, and I did feel better and more rested and was able to be on a better sleep cycle. But I was waking up in the morning and my arms were completely numb and unusable, which is very frightening the first couple times that happens, especially if you don't know what's causing it yet. But we took me off of that sleep medication and that went away. So I should probably try another sleep medication sometime soon. I'll talk to my doctor about that in our next visit. But for now, at least I can feel my arms even if I'm having trouble sleeping. But that's kind of the way that it works, where we dial things back in a process of elimination in conjunction with our doctors to figure out what's going on. And keeping track of something also helps. They're really just gathering different types of data. I know it can seem like a pain when a doctor's like, okay, I want you to keep a journal of this now. But there are so many different ways that you can do it. There are a lot of apps available as well for tracking your menstrual cycle and stuff like that. And you could even use that same type of app to just track your nightmares if you wanted. You do not have to be a uterus haver or someone who menstruates in order to use those apps for other purposes. They essentially just work like a tracking calendar. So you can try a dream tracking app, or you could also just reutilize a different type of app for your own purposes. Think outside the box and whatever works best for you, whether that is physically writing it down with like a calendar because you need that physical reminder, or setting a reminder on your phone. Do what works best for you to help your doctor come to a conclusion with you about your health. Now, if your nightmares are not illness or medication related, that's okay. There have been several studies that have found that 70% of adults who have nightmares, including ones caused by PTSD, general depression, anxiety, etc., can be effectively treated through behavioral changes. 70%, that's quite a bit. So there's a lot of power in changing our behaviors, both for our emotional health, our spiritual health, and our physical health at this point, in addition to our mental health. So if you want to try these types of behavioral techniques, I really recommend talking to a doctor, and some of the things they might try with you include imagery rehearsal treatment. That's part of cognitive behavioral therapy, and they particularly use it for recurrent nightmares, so having the same nightmare repeatedly, and nightmares especially caused by PTSD. Cognitive behavioral therapy is one of the big ones for PTSD, and that helps people who are having these chronic recurring nightmares kind of change their nightmares in a way by thinking about how you want them to act out instead of how they act out naturally. So in some cases, they might use medications with therapy to treat PTSD-related nightmares, but interestingly enough, imagery rehearsal treatment has been found so far to be very effective, even when compared with medications, which have not been necessarily proven to be as effective as that imagery rehearsal treatment. Now, I have somewhat had success with that in my own personal life as a small child. Now, it's weird, but when I was a little kid, I watched an episode of Barney, and Barney said that you should try to make friends with the bad characters in your nightmares, and that you can change things around that way. So Barney was essentially being a proponent of imagery rehearsal treatment without me really understanding the terminology for that or really what that meant. But I really took it to heart as like a tiny 5-year-old who was having a lot of nightmares that were recurring, where this guy had a chainsaw for a head, and then he would kill 2 adults that were in my house, and my sister and I would run outside to the end of the driveway, and the chainsaw guy would come halfway down the driveway and then drop his chainsaw and disappear. I had that dream for many, many, many years. Very frequently. I still don't know exactly what it was about, but I was truly freaked out by this chainsaw man that also had a chainsaw for a head. There were a lot of chainsaws going on. But it was usually the exact same, and at certain points in my life, I would get a little bit further down the road before I would stop running. So the dream developed a little bit, even though it was the same basic principle each time. But through taking Barney's advice to heart in this kind of enactment of imagery rehearsal treatment, those nightmares stopped going away. I never shook hands with that guy, but it ended up being really helpful for me. So that has been efficacious in my personal life, and I encourage you guys to try it as well. There's also a bunch of other steps you can take on your own that could reduce the frequency of your nightmares. Keeping a regular wake-sleep schedule is important, so I try really hard to still wake up at the same time, even if I'm having trouble sleeping throughout the night. Having regular exercise is important. That can help alleviate the anxiety and stress if that is what is causing your nightmares. So relieving the trigger for that is going to also relieve the amount and frequency of your nightmares. You might find yoga and meditation to be helpful for you as well. I'm not that keen on meditation, as I've discussed with you guys, but going out and cultivating a sense of awe, like going on a long hike or something, can also be helpful for those of you who are more into walking meditations. If you have trouble sleeping, you also want to make sure that your bedroom is a super relaxing place. Remember that most sleep scientists will tell you that your bedroom should be reserved for sleep and sex. You don't want to associate it with stressful activities. You don't want to be doing your work in bed or checking your email. And just be mindful about your use of alcohol, nicotine, and caffeine, because those can remain in your system for over 12 hours and disrupt your sleep patterns. So for some people, as we discussed in our caffeine episode, they just cut caffeine off at 5 p.m. and they're fine. For other people, they can't have it past noon or they will not be able to go to sleep at night. So keep that in mind and see how your body is different, because we are all similar, but we have unique differences that are important for our own physical health and wellness, in addition to our mental, emotional, and spiritual wellness. We're going to go on another break, and when we come back, we're going to talk about some other causes of nightmares.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
impact your health. Now we're going to talk a little bit about some things that cause them. So nightmares can be really difficult regarding tracking down what can cause them. So we discussed a few things earlier that are related to your health, like PTSD, anxiety, depression, obesity, diabetes, and heart disease. But they can also be caused by watching scary movies, reading scary books, playing scary video games, being on some over-the-counter sleep aids can do it, having an illness or a fever. They call them fever dreams for a reason. If you are having nightmare disorder in and of itself, which is what your doctor may tell you if you've narrowed down and eliminated out everything else. You can also get it from narcolepsy. So that is extreme drowsiness during the day, followed by quick naps or sleep attacks, as they are sometimes called, where you suddenly become very sleepy and fall asleep. They can also come from PTSD. So we think of PTSD as being something related to military personnel, but it is a lot more broad than that. Anyone can get PTSD from traumatic events. It's called post-traumatic stress disorder. That's what that stands for. So it's not post-traumatic military stress disorder. It is just due to any type of truly traumatic event. And it can be witnessing the event or experiencing the event. So you need to be mindful about that as well. Just because you were not directly involved, perhaps, just witnessing it can really negatively impact you. And that is okay. That does not make you weak, and that does not mean that you don't have a right to that traumatic pain. Everybody reacts differently to different stimuli in different ways, and that is okay. That's just human variation. That's very normal. So even if you feel that, oh, well, it wasn't that bad compared to my friends' experiences and stuff, don't do that to yourself. Everyone has their own personal thresholds. One person's 10 is another person's 2, and vice versa. And that is totally okay. It's all right to accept our pain as being valid and going and addressing that with a healthcare provider. They're not going to judge you compared to your friends. It is about your own personal particular history. So if you're having nightmares, that's not the same as sleepwalking, and that is also not the same as night terrors. So we want to make sure that we are thinking of these differently, because a lot of folks think of night terrors and nightmares as being the same. If you go to your doctor to be diagnosed with nightmares, then they may ask you questions about your use of stimulants, so caffeine, alcohol, even illegal drugs, any other types of stimulants you may be using. So caffeine is not just coffee and drinking other types of sodas and stuff like that, or energy drinks. That also includes taking those energy pills. So you really want to keep that in mind. If you think that a new medication may be prompting the nightmare, ask your doctor about alternative treatments, although they may recognize that themselves, especially if they're the doctor who prescribed it. They may recognize that pattern. They don't really have specific tests for diagnosing nightmares, but your doctor may recommend that you perform a sleep study. So during the sleep study, you spend the night in a lab, so it is an overnight stay, but you're mostly just sleeping, so you don't have to really do anything. But the different sensors are going to monitor functions in your body, including your brain waves, your breathing, your heartbeat. You'll have that little thing on your finger to monitor your blood oxygen levels. It'll track your eye movements for your REM sleep and everything, and your leg movements for restless leg syndrome and whatnot, and also your muscle tension. If your doctor thinks your nightmares may be caused by another underlying condition, then they may run other tests. If you're going to be treating nightmares, then your doctor may prescribe a blood pressure medication, especially if they're related to PTSD. Now, you might not think that that is going to be helpful, but it is. There is a blood pressure drug called prazosin that they sometimes prescribe for that. I also have propranolol as one of the ones that they will prescribe for that. Propranolol is a beta blocker, and the way it works is it just chills you out by keeping your heart rate at a lower level. when we become anxious, our heartbeats can speed up. I'm sure that you have thought about that before. You have an anxiety attack, you're feeling anxious, and your heart rate increases. Well, when that happens, your blood is pumping more throughout your body, and then you may end up in a positive feedback loop where your heart is racing and you're becoming more anxious, so your heart is racing more, and vice versa, because your body is just kind of amping you up for a fight or flight or flee or fawn response. So at that point, having propranolol or prazosin can really help you out a lot because it chills out your heart rate and it stops that positive feedback loop in its tracks so that your heart rate cannot cause more problems with your anxiety. It's no longer reinforcing each other at that point. So you may go, PTSD, that is, about stress and depression. So why on earth would they give me a heart medication for it? But it helps. It really does. And it's very interesting when they first explain it to you. But if you're not sure why your doctor wants to give you something, ask them. That's what they're there for. You can also talk to your pharmacist about it. Your pharmacist is going to generally be a lot more knowledgeable about the specific medications, whereas your doctor may be more knowledgeable about the disorders in and of themselves. So you can talk to either or both of them. Your doctor might also recommend counseling or other types of stress reduction techniques. So self-care, super important, you guys. Can self-care help reduce nightmares? They really might be able to. So keep that in mind and really do the things that help calm you down, the things that are cathartic for you. And as I call it, help get the demons out. So I don't mean literal demons, but really, those metaphorical demons that we all carry around in our baggage. So if that means journaling for you, or like for me, it's playing music and singing, that really helps calm me down. I find it super cathartic. And then it's just very relaxing. So sometimes I'll do that if I'm feeling super stressed. Working at home tends to be super conductive for that, but you can also do that in other types of ways, just depending on where you're at. Take a ukulele in your car, play it in your car at work on your lunch break. No judgment, man. There was a guy at my old job who used to bring a guitar in, and people might be like, oh no, it's that guy. You're being that guy by bringing your guitar in here. But, play it in your car. Play it on the hood of your car. Just go outside and chill. Get some fresh air. Whatever works best for you to reduce your stress. It's important to do that in the midst of your stress and in the middle of your day, but also before going to bed as well. So getting you a bedtime routine that is stress reductive can really help out. So about your nightmares, what do? So you can try a couple different things like exercising at least 3 times per week. You can avoid tranquilizers, so sleep medications, or just try a different one. Do a relaxation technique like that progressive muscle relaxation technique I discussed with you guys a week or so ago in a previous podcast. You can go ahead and do that before you go to bed, or try yoga or a meditation. My ex does a meditation for an hour every night before he goes to bed. He sleeps like a baby. I've not found that to be as efficacious for me, but he swears by it. But he also does it when he wakes up in the morning, and so he wakes up, gets straight out of bed somehow, and goes ahead and meditates for an hour before work too. So it really centers him to reduce the amount of stress that he's really going to engage with throughout the day, and also to wind down at the end of the night. You can also establish a better sleep pattern by going to bed at the same time every night. I know a lot of new phones like mine also have a feature on them that will remind you when to go to bed and when to wake up for it. So I still have to set my alarm, but it tells me how many hours of sleep I'll get if I go to bed at a certain time. I tend to need about 9 hours of sleep. I am a sleepy bear, and I just really need a lot of sleep or I feel gross. If I get fewer than 6 hours of sleep, then sometimes it even makes me feel nauseous. I will wake up feeling nauseous and gross just from not getting enough sleep. I have thrown up in airport parking lots before because I've only gotten a couple of hours of sleep before a flight. Now that doesn't really bother me. I mean, I can just roll with the punches at that point, but I don't love it. So I really try to work on that for myself and make sure that I do get enough sleep. So I know the amount of hours that I need. If you aren't sure yet, start keeping track of how many hours of sleep that you're getting per night and how you feel the next day. To be clear, it doesn't make me feel queasy. It just makes me nauseous until I throw up, and then after a little bit, I feel fine. That is super rare, but it does happen if I have to be up super early and I've not gotten enough sleep. I generally feel really tired all the time. That probably only happens like once or twice a year tops. But if you are like me and you react very poorly to not getting enough sleep with nausea and headaches and stuff, really start keeping in mind how much sleep you may need to be getting. If you feel gross when you wake up, you may need more sleep. Or if you are oversleeping, you may need less sleep. Remember that sleep scientists say you need between about 7 to 9 hours of sleep per night. Now, if your child is having frequent nightmares, go ahead and try to get them to talk to you about it. If you're having frequent nightmares, you may want to talk to a friend about it. Explain to your kids that nightmares can't really hurt them. Make sure your kids have a bedtime routine. Help them relax with deep breathing exercises or introduce meditation. You can have them rewrite the ending of their nightmare as well, or keep a dream journal. There are a lot of different ways that we can approach that for kids and for ourselves. We're going to go on another break, and when we come back, we're going to talk specifically about nightmare disorder. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Talking about what to do about nightmares and how they're diagnosed in sleep studies. Now we're going to talk specifically about nightmare disorder. So nightmare disorder is when you are having very common recurring nightmares that happen super frequently. They cause you a lot of distress, they disrupt your sleep, and they are at the point where they're causing problems with your daytime functioning or even making you afraid of going to sleep at a certain point. So that's different from just having nightmares. You can have chronic nightmares without it being considered nightmare disorder if it's not causing you a lot of stress and making you lose a lot of sleep and also making you afraid to go to sleep. So you're more likely to have nightmares in the second half of your night, as we discussed earlier, as your REM cycles get longer. And nightmares can occur rarely or more frequently with nightmare disorder, even several times per night. A lot of these nightmares and nightmare disorder are generally brief because they wake you up, and going back to sleep can be really hard sometimes. Nightmares and nightmare disorder could involve a very vivid dream, something that seems real or is very upsetting, or gets more disturbing as the dream develops. Your dream storyline is often related to threats of safety or survival, but it can also have other disturbing themes. If your nightmares are waking you up, then you may be associated with nightmare disorder, maybe experiencing it. If you feel anxious, angry, sad, scared, disgusted as a result of your dream, if you're having these typically termed negative emotions that are associated with it and you continue feeling those after you wake up, they're kind of hard to shake, then that may be nightmare disorder. Also, if you feel sweaty or you have a pounding heartbeat, if you can think clearly upon awakening and recall details of your dream, or if your dream distresses you so much that you have a lot of difficulty falling back asleep. Those symptoms are associated with nightmare disorder specifically. Now, it's only considered to be a disorder if you are experiencing frequent occurrences, if you're having a lot of distress or impairment during the day, like you're anxious or persistently fearful about going to bed or having another nightmare, if you're having trouble concentrating or you're having trouble with your memory, or you can't stop thinking about the images from your dreams, like you get absolutely fixated on it. If you are very sleepy in the daytime, or you're fatigued, or have not a lot of energy, or you have difficulty functioning at work or school or socially, or you have different behavior problems related to bedtime, or you're afraid of the dark in that way, it can cause a lot of problems. And that can happen with adults and with children. Either can have nightmare disorder. So when should you see a doctor about that? You don't have to worry about just occasional nightmares. If your kid's having them or if you're having them, it's okay. You can talk to your doctor at your well check exam. You don't have to go in specifically for that. Same thing for your kid, for their pediatric well check exam. You can just mention it to the doctor then. But you should go sooner and discuss it more with them if they're occurring frequently and persistently over time, if they routinely disrupt your sleep or they make you afraid of going to sleep and cause daytime behavior problems or difficulty functioning. I think a lot of times we think of little people as being just generally disruptive. It's like, oh, they're being a kid, like they're kids and they're just being kids and they're acting out. But a lot of times behavioral issues can stem from something else, such as nightmare disorder and trouble sleeping, or even in the case of some of my friends' children, the kids were actually having these different types of seizures that can result in some behavior issues. And everyone thought that the kid was just acting out, and that was not the case. And it's very fortunate that his parents took that so seriously and were like, no, I have a really good kid. He's trying really hard. This is out of character for him. Let's go see what's going on. And sure enough, he was having seizures. So I'm not trying to make you guys panic. I'm just saying sometimes kids will be kids. A 4-year-old who has trouble sitting down and staying sitting down and not interrupting is just a 4-year-old. That is their attention span. It's really difficult for them. They are at a different stage of cognitive development, and we can't expect the same things of them as we do for kids who are 12 or 15 or 18 or even full-grown adults. We really have to keep that in mind, that there are certain things that are normal for kids, and that's okay. Now, if they are having a lot of these behavioral issues or they're increasing, and you also notice they're having trouble sleeping, mention it to their doctor. Or also ask your kid, hey, have you been having trouble sleeping? How are you feeling when you wake up? And that can really help out a lot. I think a lot of times folks also make assumptions about children, not just related to their behavior, but we tend to tell them things rather than ask them things. And it's very important to ask them these questions as well. Just like you want your doctor to take a part in partnering with you for your health, it's also important to be mindful of that with kids. They're small people, but they're people, and they have their own wants and their own needs and their own mindsets about things. I think we very much underestimate how much they understand or care about certain things, and we should really be asking them questions instead of just telling them, hey, how is your sleep going? What time did you fall asleep last night? What time did you wake up? And without, going in on them if they stayed up too late and stuff. There's definitely a time as a parent where we have to go, hey, you can't stay up till 3 a.m. when you have to be up for school at 6 a.m. That's not cool. But there's also a time to go, okay, you didn't fall asleep until 3 a.m. Can you tell me why? Why were you having trouble falling asleep? It may be the TV or the radio, or it may just be that your child has trouble sleeping in general, or they're scared to fall asleep, or they're having sleep problems, like nightmares. Now, nightmare disorder in general is referred to by doctors as a parasomnia. So you've heard of insomnia, but parasomnias are types of sleep disorders that involve undesirable experiences that happen while you're falling asleep, while you're asleep, or when you're waking up. They generally occur during REM sleep. The exact cause of nightmares is not known yet, but we talked a little bit about some of the trigger factors earlier, including medication, stress, anxiety, substance use, and scary books and movies. But having nightmares is also more common when you have family members who have a history of nightmares or other sleep parasomnias, like talking during your sleep. My sister and I used to talk to each other in our sleep when we shared a room as kids all the time. We would not remember any of it, but my parents said that we would carry full-on conversations. I also would sleepwalk. My sister, not so much. She was more just a sleep talker, but I would get up and go get a glass of water and sit back down and only wake up because I had poured it on myself by mistake and stuff like that. So if you have one type of parasomnia, you may be more likely to have another one. Or if you have family members who have a parasomnia, then you may be more likely to have nightmare disorder or nightmares that are recurring or chronic in general that don't necessarily qualify as nightmare disorder. So we think of like sleep talking and sleepwalking as being kind of funny things that especially kids tend to do or that our family members tend to do. But if we really sit down and think about it, it's like, oh, this could really be impacting my health more negatively. I also have an aunt who used to sleepwalk when she was younger. I don't know if she still does that now, but she did that as well. It was one of my dad's sisters. So there may well be a genetic link to it. Scientists are really studying that. And they have found that family members who have a history of other parasomnias are more likely to have that in someone else in their family. I think that's very interesting, especially since my aunt is a lot older than me. She was probably 18 or 20 when I was born. So I never lived with her during that time or ever. And I never really saw her exhibit any of these symptoms of a parasomnia, just the stories that they told me as I grew older. And they're like, oh yeah, you sleepwalk, your aunt does that too. And they told me all about it. So it's not like I was influenced by that. It's just a very interesting coincidence that researchers have really noticed and have started thinking may be a genetic predisposition for these types of sleep disorders. Nightmare disorder can also have a few complications, including being super sleepy in the daytime. So if you are having trouble staying awake at work or concentrating, or your kids' grades are dropping, or they're having trouble staying awake at school, then let's go ahead and ask them about how they're sleeping and everything too. That might be a big problem that they're having. And it's not that they don't want to do well in school or that they don't want to pay attention, but they're struggling to do so. You may also have trouble with driving or concentrating in general. You may have trouble with your mood. So depression and anxiety are mood disorders, and they tend to also get worse if you have dreams that bother you over time. If you are wanting to avoid sleep, or if you're having suicidal thoughts or suicide attempts, that may be related to nightmare disorder if you're also having these nightmares, and you should really talk to your doctor at that point. All right, we are going to go on a quick break, and when we come back, we're going to talk a little bit about nightmare therapy. Stay tuned.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
About nightmare disorder. Now we're going to talk a little bit about how we can treat nightmares through nightmare therapy and the difference between nightmares and night terrors. So, with this topic, you can try IRT on your own. And we talked about that a little bit earlier, where it has a 70% success rate for changing your nightmares just through your behavior, where you are painting a picture in your mind's eye, more or less. So we're changing our behavior via cognitive behavioral therapy in order to affect the outcomes of our dreams. Now, some doctors say that it's possible to do it on your own, but if you have PTSD or another psychological condition, then a lot of doctors recommend that you attempt that only with the help of a doctor or therapist. That way you're doing it correctly and in a safe, controlled environment to make sure we're not exacerbating any other symptoms related to PTSD, anxiety, stress disorders, depression, and so on. We want to make sure that we are doing that properly, just like any other type of treatment. So working with a professional can also be really helpful for folks who have trouble visualizing their dream images when they're awake. There are a lot of people who have trouble painting a picture and really dealing with the concept of the mind's eye. But if you speak with a doctor about it, you can improve your capability of creating those images, or at least learning to think of them in a different way. There are a few different ways that you can try to control your nightmares, but more or less, we can reduce it to being like a 3-step process via IRT. One of the first steps for that is going to be writing down a short description of your recent nightmare. If the one that you had the most recently is way too upsetting to think about, that is totally okay. Choose a different one. That's totally fine. You do not have to write down and re-experience any that are too upsetting. If you're having your child do this as well, keep that in mind too. Now, if you are going to go ahead and write it down, I recommend keeping like a nightmare journal, and maybe keep that separate from your dream journal. So front half dreams, second half of your journal nightmares, or 2 separate books, just like how I keep my shadow journal and my gratitude journal separate. I don't really want to open up my gratitude journal and be reading about things I'm happy about and then go, oh no, here's some nightmares. It is nice in a way, I think, to keep those separate, but also in a cohesive manner. So it's both practical and emotional, because then you can just take your nightmare journal to your doctor, and you can also draw a little calendar in there. So if you write the date of the nightmare on it and then the brief description, then later on you can go through and put a little X on a little calendar you draw in there, just like you would for bullet journaling, and see if you can find a pattern in it by putting it in kind of a spreadsheet or grid pattern. I like that a lot. For me, it helps me to think visually and to pick up on patterns I might not necessarily notice with just the numbers. So I recommend keeping those separate and going ahead and tracking the dates and everything as well. And that way, even if you just go back at the end of each week or at the end of the month, you can go and plot them out on a calendar as long as you put the date down initially. You can also keep track of your diet along with that. I'm a big fan of bullet journaling, and one way I would like to do that is just to go ahead and write nightmare as one of the areas of my bullet journal, and just be able to put an X on there when I get to the date, and then follow up with my nightmare journal separately. Now, once you have written down that description of your recent nightmare, remember, you don't have to go super in depth. It's just a brief description. Then you can go ahead and start thinking of a way to change your nightmare in step 2. A lot of doctors will not tell you specifically what type of changes to make, because they don't really know what in particular is distressing to you, and your intuition may guide you better than them just trying to use a checklist or a troubleshooting tree and go, okay, change this, okay, change this. They're not tech support, although doctors can sometimes operate very similarly in that fashion, but they're going to go ahead and be like, okay, you should try to make some changes. think of different ways that you can change it. And you don't have to implement them all at once, but it's really important to consider different types of changes. You can do one or more at a time, or you could also just try one at a time until you get to where you want to be. But I like doing the exercise of thinking about all the different ways that I could change something. Now, once you have done that and your doctors encourage you to use your intuition to make these changes, then you're going to set aside a few minutes each day to really imagine that different version of your nightmare. You're trying to paint a mental picture of that new version, so thinking out how it goes and changing the things that you want to see, like how when I was little, I decided that I wasn't going to be afraid of the chainsaw guy and maybe he was my friend instead. So I did have dreams still where he was present and he and I never shook hands or anything, but I was no longer afraid of him at that point. Now, that did not help me determine what precisely was causing the nightmare, but again, I was a little kid and I wasn't focused on that part. I just didn't want to be scared anymore, and I was taking the advice of a purple dinosaur as essentially my medical advice. Turns out Barney's right about IRT. Who would have known? But my overall point is that you don't necessarily have to understand the whys of it to do the hows and to go ahead and try to change that. Now, we say paint a mental picture of that version, but a lot of folks really do struggle with seeing pictures in their mind's eyes. And that's okay. You don't have to be able to see it. A lot of folks think in words instead of in pictures, and you can think about it that way as well. However works best for you to visualize it is the route you should take. So visualization does not mean that you have to see a picture in your head per se, but rather thinking it out from beginning to end and altering the ending of it or altering the portions that are causing you problems. So for a lot of folks who have chronic nightmares, especially people who've had them for many years, it may sound really reductionist and hard to believe that you can use a DIY effect to really work on your nightmares. And I totally understand anyone's reluctance to believe that. If I had not experienced it myself when I was younger, before I found out that it has a name, and I was just using a purple dinosaur's instructions, then I probably would have been less likely to accept it as well. I didn't find out about IRT until this year, actually, and I do literally mean 2020. So that has been a big difference for me. It's the joy that you get when you are finally able to put a name to something that you have always known to be a truth or to be something that existed. I'm sure there's probably a German compound word for that or a French one, but you get where I'm coming from at this point. So that was really big for me, but I, as an adult, would not have really believed that had I not experienced it through the eyes of a child. So try it. Go ahead and let your inner child out for a little bit and go, okay, we're going to play pretend. We're going to pretend that I think that this could be effective and see how this works. We're going to write down this recent nightmare. We're going to think about some ways we can change it. And then we're going to play pretend and imagine different versions of our nightmares in real life. So in that way, you are addressing your brain's attempts to process whatever is bothering you. It's an abstract way to do it, and it might not be the go-to that a lot of pragmatic adults, like we tend to like to think that we are, would think would be a great option, but it can be. So go ahead and try it. A lot of folks, when you think about IRT, it's almost like you think that process is disrespectful to yourself. Dr. Krakow says that he thinks about that with his patients as well. They're like, what do you mean? I just write down a nightmare and change it and picture it in my mind? That sounds wonky. That sounds really silly and like a My Little Pony Care Bear type dream. But it's not. It's not like change 2 dreams and call me in the morning, as Dr. Krakow says. It's really taking your thought processes into your own hands. And you might not think that you can, but I definitely encourage you to try it several times. I think a lot of folks give up on things really quickly if we are not great at them initially and we don't develop skills in it. But it is a process, and I think that if you try it out, it might well work for you. A lot of folks who have tried this say that they still have some nightmares, but they're much less frequent. They only have one like every 6 weeks or so, and when they do have them, they found that they are less upsetting than they used to be, and have said they're more rested, they're happier, and they're able to be more active during the day. So if those pros sound great to you, what do you have to lose by trying it? You don't even have to tell anyone else that you're trying it. It's your own little nightmare journal and your own imagination where you're doing this. You could do this on your lunch break at work even, the imagination component. And no one would even know because you don't have to take your nightmare journal with you to work. So try it out and see how that helps. It's a great non-invasive and non-chemical way to try to address your nightmares. Although, again, I don't have any problems with people using Western medicine for that, just to be clear. All right, guys, we're going to go on a quick break, and when we come back, we are going to talk about night terrors and sleepwalking.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about controlling our nightmares with IRT, a form of cognitive behavioral therapy. Now we're going to talk a little bit about night terrors and sleepwalking. So, in general, there is a shared component of night terrors and nightmares. They can both be very upsetting and cause you problems when you're sleeping. However, they do have some significant differences. Nightmares tend to be dreams that have very explicit, unsettling content and usually occur during REM sleep. That's when your brain is most prone to vivid dreaming, and that's also why your nightmares tend to occur later at night or early mornings. Night terrors, on the other hand, tend to occur earlier, during non-REM sleep. Nightmares are really vividly recalled, so because you are having vivid dreaming and they're occurring mostly during REM sleep and closer to the point when you're waking up, then you're going to be more likely to remember them. They are really bad dreams that are very upsetting. Night terrors, though, may be associated with shouting, sleepwalking, screaming, or feeling scared or even looking scared for several minutes before you relax back into sleep. And then you may recall that later very vaguely or not at all. It can be really difficult for someone else to watch this happen. It can be very scary for other folks to witness, but night terrors aren't generally harmful, and generally the sleeper isn't going to remember it in the morning. So it's more distressing to anyone who sees it than really the person experiencing it, whereas nightmares tend to be the other way around. Night terrors are also more common in kids. So anyone can experience a nightmare or a night terror, but night terrors in particular are much more common in kids than in adults, especially between the ages of 4 and 8. Night terrors tend to reduce as a child gets older and may altogether go away. Nightmares, on the other hand, can affect any age, although they are somewhat more common in kids. Now, whether your concern is night terrors or nightmares, If scary dreams are keeping you or your kid awake at night for several nights or weeks in a row, I would really encourage you to talk to your doctor or your kid's pediatrician for that. Because those sleep disruptions, as we discussed earlier, can really hurt your daytime energy levels and can also positively reinforce other health issues. So we do not want those positive feedback cycles. It has the word positive in it, but that just means they reinforce each other. It's not truly positive at all. So in that manner, definitely talk to a medical expert to make sure your kid and you can get a good night's sleep. Because if your kid is suffering from these, chances are you're probably awake too. And while your focus may well be on your child, it can also give you some caretaker fatigue, and it's important to keep that in mind too. Now for sleepwalking. I think that sleepwalking is one of the more fun disorders that are parasomnias to talk about, but it doesn't necessarily mean it's fun for the people experiencing it. Granted, my sleepwalking never really upset me, but, it can freak out other people. And it's something that as a kid, I did have to warn people about before I did a sleepover. It's not so much a problem now, but, back then, people would be like, oh, that's weird, you sleepwalk? That sounds creepy. And then, they make the Frankenstein or the mummy walk at you for a little bit. And, I was never a super sensitive kid, so it didn't really bother me. I thought it was funny. But for some people, everyone reacts to things differently, and that can be a big factor for them. So I've found that one of the best ways to work through being embarrassed or scared or upset about something is really understanding it. I find a lot of solace in education and knowledge in general. What I know, I can work with or I can fight. So, to that end, we're going to talk a little bit about some issues related to sleepwalking and how the National Sleep Foundation feels about that, an organization of sleep researchers. So sleepwalking is also called somnambulism, and it is technically a behavior disorder that happens during sleep, and it may result in just walking or acting out other weird behaviors while you're asleep. So I told you guys I've gotten up before and gone and gotten a glass of water and sat back down with it. That is not that uncommon for me. Like when I sleepwalk, I'm not just walking around. My unconscious mind has some sort of goal it is going for. I think that I'm hungry or I'm thirsty or I have to go to the bathroom. And my mom used to just lean into it and she's like, okay. And she would just walk me to bed or wherever I was going at the time. Or just keep an eye on me. And I didn't really have any difficulty with knowing where I was going. I didn't walk into walls, so I don't know what that's about, but it is different for everyone, and you may perform really complex behaviors. It's not just necessarily walking around. It's more common in kids than adults by far, and it's also more likely to happen if you're sleep deprived. A sleepwalker will typically stay in a really deep sleep throughout the entire sleepwalking episode, and you may be really difficult to wake up and probably won't remember sleepwalking at all. Sleepwalking often involves more than just walking during sleep. You can also do other weird stuff. You might just sit up in bed and look around. If you're feeling too warm, you may take off your PJs, or you may walk around the house. You may even leave the house or drive long distances. That has happened to a couple people, especially folks who are on tranquilizers. Now, a lot of folks are like, oh no, it's really scary to wake a sleepwalker. You shouldn't do that. You can hurt them, hurt yourself. But that's generally considered to be a misconception by the National Sleep Foundation. It can be dangerous to not wake a sleepwalker in some cases. So you really want to gauge that for yourself and or talk to a doctor about it if this is a regular occurrence for you or another sleepwalker in your life. So in regards to these very complex actions, once my aunt, who also sleepwalks that I mentioned earlier, when she was a kid, she got up, walked all the way out to the doghouse with a blanket she was carrying in the snow, covered up the dog, then came back into the house and went back to bed. The cold of the snow on her bare feet did not wake her up. She did not recall going out in the middle of the night to cover up the dog with a blanket or anything. It was just something that my grandparents saw, and they're like, okay, that's weird, but I guess she's asleep, and we just have to live with that right now. So it can be very complex, and you would be surprised just how deeply asleep a lot of sleepwalkers stay. You would think that something frigid like snow on bare feet would wake a person up, but it didn't. She was able to unlock a door, go all the way outside, have the presence of mind in her unconscious state to carry that blanket, cover up the dog, and go back in. Perhaps she was subconsciously worried about the dog staying warm enough in the North Carolina winters. Who is to say? This was, 60 some years ago probably at this point. So that's pretty wild, but I also think pretty cool in a way. So your body is acting out these things that you're never quite sure why you're doing it, but they're fun to think about. Now, the prevalence of sleepwalking in the general population is estimated between 1% and 15%, and it's actually not that uncommon for folks to start sleepwalking in adulthood or continue sleepwalking when you're an adult. It's also generally not associated with anything that is psychiatric or a psychological problem that could cause you significant harm. There are different triggers for it that are generally related to sleep deprivation, sedative agents, so that could be tranquilizers that you get from your doctor, or alcohol even, certain types of illnesses where you have a high fever, and different types of medications. So, although children are more likely to sleepwalk, especially between the ages of 3 and 7, so that's very similar to the night terrors we talked about earlier, which is between the ages of 4 and 8. It also tends to occur more often in kids with sleep apnea. So there's a higher instance of sleepwalking among children who experience bedwetting in general. That was not my general problem, but my sleepwalking and talking in my sleep and everything else, those parasomnias, were very strong with me as a kid. So they may experience bedwetting or they may not. But if your child does bedwet, they may have a higher instance of sleepwalking and vice versa. You also have sleep terrors as a related disorder, and both sleep terrors and sleepwalking tend to run in families, like we talked about earlier. So in general, sleepwalking is usually initiated during deep sleep, but it can also occur in lighter sleep stages within a few hours of falling asleep. And in addition to walking during deep sleep, some other symptoms include sleep talking, having little or no memory of the event at all, having a hard time waking up the sleepwalker, having any inappropriate behavior like peeing in closets. That one's really common in children. And also screaming. So sleepwalking can occur in conjunction with sleep terrors or night terrors. And so that can be pretty scary if your kid just wakes up, it isn't waking up in the middle of the night, but your kid walks into your room in the middle of the night and just screams. That can be terrifying in and of itself, but your child may be just struggling with night terrors and sleepwalking. It may be a parasomnia issue. You may also have violent attacks on the person trying to awaken the sleepwalker. So, be conscious of that, especially if the person does have a comorbid disorder like PTSD. You maybe don't want to wake them in all cases. Just keep an eye on them, make sure that they are safe. Make sure they're not picking up knives and stuff. Now, they don't have a specific treatment for sleepwalking, but in a lot of cases, just making sure that you are going to sleep in a good environment with a good temperature that's comfortable for sleeping for you, and that you are comfortable in your bed and you're keeping your bedroom reserved for sleep and sex. That can be really helpful. We want to make sure we're not reading in bed and stuff. Now, a lot of experts also recommend having a regular, relaxing routine prior to bedtime to help prevent sleepwalking, and avoiding alcohol and certain medications prior to bed. So really, the TLDR of this is that having a regular bedtime routine is not just for kids, it's also for adults, and not only will it make us feel more well-rested, but it can also reduce the risk of sleepwalking, night terrors, nightmares, and a host of other parasomnias. It's really important to be able to do that. If your child sleepwalks, don't let them sleep in the top bunk. I have fallen off of the top bunk onto a wooden stool I made myself as a small child, and that was painful. Fortunately, I don't think I broke anything, but it did not feel great. So maybe have them sleep on the bottom bunk if they are sleepwalkers, and make sure you kind of sleepwalker-proof the room, just like you would child-proof anything else. Get rid of sharp or breakable objects near the bed, put gates on your stairways, and if the person who's sleepwalking is a certain height, then keep that in mind when you are selecting the height of this gate. Because if the person is tall, you don't really want a gate that's going to be at their knees or at their waist, because they can still fall down the stairs. You want to make sure that it is an appropriate height. So keep that in mind. Lock all the doors and the windows in your home. You want to make it harder for the sleepwalker to get out. Now, it does not mean that they are not necessarily going to unlock a door in their sleep, but it is important to take precautions in that, because an ounce of prevention is worth a pound of cure. Lastly, we found that according to the National Sleep Foundation study, they did a Sleep in America poll in 2004 and found that 1% of preschool children and 2% of school-age children walk in their sleep at least a few nights per week. Now, that's maybe not sounding like that many. It's 1% of preschool kids and 2% of school-age kids. But that's still a lot in the United States, and they're walking in their sleep at least a few nights per week. So if you are struggling with this, chances are there are a ton of people around you who are too. Go ahead and talk to your doctor. They've probably already heard all of it before, and they're ready to help you out with this. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.